Hello, everyone, and welcome to today's program. Today's program will be presented by management and leadership expert Chris DeVany and is entitled Time Management Tactics, Get More Time to Run Your Practice. All participants are in listen-only mode, and at the end of this webinar, you will have a chance to ask Chris all of your questions. Just use the chat box on the webinar toolbar to submit your questions. Please know that all questions will be addressed at the end of this webinar. As I mentioned, our speaker for today is Chris DeVany. Chris is the founder and president of Pinnacle Performance Improvement Worldwide, a firm which focuses on management and organization development. Pinnacle clients include healthcare organizations across the country from frontline physician practices to government agencies. Let's go ahead and get started. Welcome, Chris.
Thank you so much, and welcome everyone. So glad you could join us. Let's dive on in. All right, let's see if I can get this. There we go. Whoops. So we have four primary objectives today. We want to describe the benefits of developing time management skills, differentiate between all the different types of tasks we have to complete, analyze and use tools for organizing tasks, and practice proven rules and techniques for managing time effectively. In short, we'll address changes in choices, tools and rules, prioritizing and planning, and moving towards true effectiveness, after which you'll have a chance to evaluate your experience today. So what would you say is the source of the greatest pressures you face? And it's okay if it's not on here, but is it customer demands, prospective customers' expectations, coworkers' needs, your managerial environment, time deadlines, and or the pace of organizational change, or something that's not even listed there? No worries. We all deal with what we call a time management skills hierarchy, and we've experienced this throughout our lives. We started when we were kids. Hey, I'll remember, Billy, I'll meet you at the playground, whatever, maybe after breakfast, whatever. Then at some point, as we were teenagers, young adults, where we are now, maybe we use Post-it notes, string on the finger, notes on the napkin, a little ad hoc system. And then at some point, a lot of us started using some form of appointment book, maybe a little black book or a desktop calendar. And that brings us to today. We're using organizers, smartphones, Outlook. And so all I suggest is that the tools you're currently using to manage your time is what we will call your efficiency-driven system. So all we're trying to do is to help you make this efficiency-driven system into what we would call an effectiveness-driven system. The same tools you're already using to manage your time, just with more purpose and more goal-oriented. And I share with you the quote from noted time management expert Ed Bliss, which says, "Effective people begin not with their work, but with their time." So let's take a look at changes in choices, knowing why we are doing what we are doing, what the goal is, will get us through anyhow, all the minor details, all the distractions. So how do you think we make most of our choices? Do we make most of our choices based on impulse, conscious choice, pressure from others, by habit, or by default? Well, the reality is the great people at Psychology Today have been surveying people for at least 50 years. I mean, I don't mind telling you, I'm in my 60s, and I remember when I was in high school that a high school teacher told me about this survey. We make about 2% of our choices based on pressure from others, 2% based on impulse, 2% by default. About 9% of our choices we make as a conscious choice. And that's actually our number one ally for changing habits. And believe it or not, we make about 85% of our choices by habit. No lie. And I'll explain how. There are 4 stages of habit change. We start with unconscious incompetency. We're not aware that we have a problem and we don't know how to solve it. Then conscious incompetency, we're made aware that we have a problem, or we are aware that we have a problem, but we don't know yet how to solve it. Then we reach a point where we become consciously competent. We're aware we have a problem and we start to learn how to solve it. And then finally, this is the great space for all of us, is unconscious competency, where we have solved our problem, whatever it is, so many times repeatedly, We don't even have to think about it. For example, when we were very, very little, we had a pair of laced shoes. The lace shoes became untied. We kept running around. We were unconsciously incompetent, didn't know how to solve it, didn't even know it was a problem. Then my mom stopped me one day. Chris, you're running around like a crazy man. Okay, stop. Your shoes are untied. Now I'm consciously incompetent. Mom has made me aware that I have a problem. I don't know how to solve it yet. I don't know how to tie my shoes. So conscious competency came when Mom started teaching me how to tie my shoes. Finally, unconscious competency. Don't have to think about it, haven't had to think about it for years. So now let's take a look at some tools and rules that we can use for managing time. The maximum performance that we can achieve requires that we use tools that effectively link activities and information. So here we are. There are 6 sets of skills that we need to continually hone, refine, and improve. And these 6 sets of skills are keeping track of our commitments, keeping track of others' commitments to us, planning, prioritizing, documenting calls, meetings, and other communications, and following up. So the recommended tools that we use for keeping track of our commitments is our to-do or activities list. For keeping track of others' commitments to us, again, our to-do or activities list. For planning, paper calendar, smartphone, timeline, paper, pen, pencil, whatever. For prioritizing, again, our to-do and activities list. For documenting calls, meetings, and other communications, paper, Outlook, Word, smartphone. Now again, I've already told you how old I am, so bear with me because I want to share a tip that I learned years ago that, believe it or not, still works really, really well for documenting calls, meetings, and other communications. Somewhere, maybe in front of you or maybe near you, might be like either a piece of paper or a pad of paper. It can even just be a piece of paper and this thing they call either a pen or a pencil. And I'll tell you what it is. It's taking notes. I'm not kidding. When you write down notes, when you're on a call, when you're in a meeting, when you're involved in some other communication, including appointments, in a doctor's office, trust me, taking notes is going to help you tremendously to document whatever you're involved with. Because after you've been on a call, in a meeting, maybe a patient has just been in for an appointment, trust me, you're going to want to send out some kind of an email at some point to verify the communication you just had. So what I do and what you can do for a call, meeting, or other communication as a follow-up, which is our last skill, is to put together this super quick 2 minutes or less email. And here it goes. If it was a call, maybe it's just one other person. A meeting, other communication, maybe there are 2 or more people involved. Whoever's involved in that communication you've just had, from my notes, what we just discussed was 1, 2, 3, ABC. 1, 2, 3 bullet points. From my notes, what we will do going forward is Chris is doing this. Dr. So-and-so is doing that. The patient is doing this. And trust me, when you document, when you take notes and then you put together that quick little broadcast email, whether it's one or more other people, you will save yourself extraordinary amounts of time. Now, if you don't have time between appointments, that's okay. You take notes, and when you have a break, you can put together that communication, or maybe it means you update some notes in your Outlook or your calendar management, your schedule management, whatever you're doing. Trust me, the taking of notes and then the documenting is going to save you tremendous amounts of time going forward. Okay, so why do we recommend these tools? A paper organizer, a calendar. They're portable. They can help you plan anywhere from a week to a year. They're cost effective. Computer organizer, calendar, smartphone. These tools help you keep track of dates and tasks, especially at work. Facilitate internal communication. Maybe it's just between you and a physician or someone else in the office. And it gives you power, not power over someone, but power to influence others to make a decision. A master personal calendar, I'm telling you, I learned this over 20 years ago, and to this day, that helps me tremendously. So however you manage your communication, I understand if you need to keep separate outlooks or separate whatevers, in other words, everything for the office has to be just on whatever tool is used there. But if you can even do this on a smartphone like I do it. Now, I have a smartphone which is synced up with my laptop at home. So trust me, I schedule things on my smartphone even when I'm in the office or involved in some other communication. And if or when you sync up that smartphone, or you can run Outlook on your smartphone to schedule your personal life as well. It works so tremendously well. A daily to-do or activities list we recommend because those tools help you to track tasks, prioritize, and plan each day. A timeline gives you an at-a-glance game plan for your day, and a filing system helps you both organize and retrieve information. So we're talking about when you can write things down, because if something needs to be saved in a manual file, there you go, you're ready. And of course, we're saving the same information electronically on our calendar or schedule management. All right. What's a be there? A be there is any activity which requires that we complete it in a specific place, on a specific date, and at a specific time. All your patient appointments, of course, are going to be theirs. That's just an example. A to-do or activities list, how does this help us? Well, I'm going to use just a little sample exercise from a day I had one day. I started with 4 activities. You see in the left column, they're labeled A1, A2, and A3. I'll explain that in a moment. And then on the right, when I estimate time that I need to conduct these activities. So it was 10 minutes for one, 20 minutes for another, and 90 minutes for a third activity. That's a total of 2 hours. And what I do, and I know you can't always do this, but try to build in little 5 or 10 minute buffers in between activities. So what I did was I built in 2 10-minute buffers to make sure I get these activities completed. What is time charging? Well, let me first give an example of the time charging system that I use, and then I'll explain how we make this work. I have just to my right here, and this goes with me everywhere, a little black leather binder. It has a bunch of loose leaf pages in it and some writing tools, pens and pencils. And I'm telling you, that is my continual or continuous to-do list. Whenever I know I need to do something, the first thing I do is I write it down real quickly. And that is the beginning of my time charging system. What is a time charging system? It's where you write activities in a place, and if you prefer, you do it on your smartphone and or your computer, but it's where you write activities in a place your mind trusts that action will be taken at the appropriate time. That's why, as I said, I still live for writing things down, because I know my system is, I know that by the end of today, everything I've written down on this piece of paper in my little book is going either onto my laptop or my smartphone, because those 2 devices are synced up, including Outlook and all the Microsoft tools that I use. So how do we time charge? We write down, well, we ask, what activity needs to be done, when does it need to occur, and where is the necessary information stored? All right, now let's take a look at how we can prioritize and plan. There's an important principle at work here. The principle is that when we dedicate ourselves to items that are important but not urgent, is what distinguishes effective individuals from ineffective individuals. So important is defined as marked by or indicative of significant worth or consequence and valuable in content or relationship, whereas urgent is defined as requiring immediate action or attention of action or an event which is done or arranged in response to a pressing or critical situation. So it's very important for you to define for yourself as well what is important, what is urgent. And we'll take a look in just a second at a delineation of those two factors, urgency and importance. So all activities fall into one of four categories. There are those activities that are both highly important and highly urgent. We call these quadrant one. And these are the things that we have to do now, or else there will be immediate and severe consequences. And I'm sure we all can think of examples there, but I'll share some other examples in just a moment. Then this is the quadrant where we want to spend as much of our time as we possibly can each day. It's quadrant two. It's activities that are of high importance but lower urgency. So in other words, we want to try to get to anything and everything that is important before it becomes urgent. That's the goal. So the consequences, though, for not doing things that are important but not urgent are severe. However, the consequences are not immediate. So we often make a big mistake and put off these tasks. The problem is when we put off tasks that are important but not urgent, they eventually make it into quadrant one, important and urgent. That's where we want to try to stay out of quadrant one as much as possible. Then there are activities that are not important to us but usually urgent to someone else, and they grab at our attention most of the time, though they're not actually as important as they feel, and we say that with all due respect to others. And then finally, there are those activities that are not important, not urgent, quadrant four, and these are the things we do when we really should be doing something else. Okay, so urgent and important, crises, problems that have an immediate impact on customer satisfaction, something that's mission critical on a deadline. For example, your customer wants an answer now. Your prospective customer expects a quote by the end of the day. Your coworker needs customer specs ASAP. Management wants to see your numbers before you go to lunch. A new initiative is being announced today. It's all hands on. Your boss demands a certain report by 10 a.m. tomorrow. Then it becomes, I need it first thing tomorrow. And oh, by the way, you know what? Before you leave today, I really need that report. Your engine blows a gasket. The labor pains are 3 minutes apart. For those who are not aware, and I'm guessing most of you are, but for those who are not aware, the American Medical Association and the American Academy on Obstetrics and Gynecology recommends that once the labor pains are 10 minutes apart, you should either be at the hospital or well on your way to the hospital. And then it's April 15th and you haven't finished your income tax forms. And I know some people say, hey, I'll file an extension. Okay, fine. Then here's the space we want to be. Important but not urgent. Strategic planning, personal development, relationship building, evaluating programs, clarifying vision and values. For example, a special course you want to take to upgrade your professional skills, writing your mission statement, that new project you'd like to suggest to your boss once you do some fact-finding, a focused planning meeting, starting that retirement account, exercising with your kids. We all can see that these are important, yet we often, for many of these, we don't schedule it. So see, when we don't schedule things like this, they don't happen. And sometimes, unfortunately, we either forget about them or they rise to the level of high urgency. Then there's urgent but not important, usually urgent to someone else, not important to you. Many emails, some phone calls, some meetings. Someone asks you to chair a fund drive or give a speech, attend a meeting, and this is a low priority, but because someone's standing right in front of you, because these have time limits, they often get done while we forget to do things that are important but not urgent. Or a coworker interrupts you several times a day with information that's just not that important. A prospect who's you've never spoken with emails you. A coworker asks you to help them solve a problem, and again, it's urgent for them, but not urgent for you. Or you've been invited to a meeting which doesn't seem to involve you. The inviter marks the meeting high priority. Then there's not urgent, not important, junk mail, spam, escape activities, time wasters. For example, pardon me, you're planning to do some specific work. Instead, you end up organizing your desk, straightening up the drawers, reorganizing files, Snapchat, Instagram, looking at websites which are not work-related. So I've conducted this seminar a number of times, often in person and what have you, probably several hundred times. And this is where I ask people, how will you use your time more effectively using important and urgent? Here are the 5 responses I've heard the most. People have said, I need to educate my team members about scheduling our conversation. So this is an important conceptual point to think about, is we can't do, none of us are effective with respect. None of us are effective multitaskers, and as far as we know, none of us have learned how to bilocate. So with that in mind, if something cannot happen this moment, might there be another day and or time that would work for both of us? So it's about, okay, it can't happen now, when can it happen? Others have said, you know, I focus on my top 3 priorities all the time. Others have said, let me plan today first, then I'll review my success at the end of the day, and I'll start planning tomorrow before I leave. Others have said, I'm going to start assessing my list of tasks for important and urgent. Others have said, I'm going to schedule all the tasks that I have on my calendar before I leave today. All right. So what now, though, with all these activities? Well, for quadrant 1, urgent and important, do what you can, to knock these out before they become urgent. In other words, while they are still in quadrant 2, important but not urgent yet. However, often there's not much we can do about these. In other words, if something makes it into quadrant 1, it's probably best, like it or not, just to get it over with so it's out of the way and we can move on, hopefully, to more quadrant 2 activities. However, it's not here that we find our time management problems. Quadrant 2, practice planning and doing these. Schedule your quadrant 2 activities and stick to your plan as much as possible. Make these sacred and encourage others around you as well to spend as much of their time as they can on matters that are important but not urgent, because it's attention to quadrant 2 activities that separates effective individuals and organizations from the ineffective ones. Quadrant 3, remember, not important to you, often urgent to someone else. Learn to manage and say no to these. Question their importance and downgrade them in priority. And then quadrant 4, not important, not urgent. Avoid activities that provide only a feeling of accomplishment. And if this unimportant, unurgent activity is a common one, follow the advice on procrastination. Why do today what you can put off until tomorrow? And keep doing that and keep doing that. And you know what? Eventually, it's going to fade away. And it's actually here in quadrants 3 and 4 where we have most of our time management problems, because we allocate too much time to things that are not important. So I asked you a question a little bit earlier. What are the sources of the key pressures? And so some thoughts about these key pressures, again, for any of these that are pressing for you. For customer or patient demands, acknowledge, underpromise, and overdeliver. For prospective customers or prospective patients' expectations, the same. For coworkers' needs, acknowledge them, assert yourself, in other words, speak up for yourself, say, hey, I'm a little busy. Discuss with your coworker your A and B priorities, maybe try to help each other. If someone else has an A priority, that's a B priority for you. Maybe you have an A priority that your coworker could help you with. So you help each other with an A and B priority. There you go. For your managerial environment, ask your manager what their top priorities are and respond accordingly. get their input. For time deadlines, plan and prioritize. And if the pace of organizational change is driving you a little crazy, stop, look, listen, take deep breaths, maybe pause a minute. And as someone once said, with all due respect, in this case, if we're talking about organizational change, as far as we know, nobody died. Let's take a breath, and now we can move on. Okay. Now for prioritizing, what is an A priority? You saw a little reference to A priorities a few slides ago. Well, an A priority is something that is critical for the success of today and in the future. So an A priority is anything which, if you don't accomplish it today, would detract from your job performance, detract from your personal reputation, and or detract from the reputation of your company. And then a B priority is just anything that's not an A. Okay? All right. When we prioritize, we want to take into account what we call the 80-20 rule. So when we prioritize action items, look for the top 20% that will produce the greatest payoff and do those first. So two examples of this are, often when we look at our schedule for a day, we can see a lot of activities that we estimate will take 5 minutes or less. Do what you can to collect those, for lack of a better term, and move as many of those 5-minute or less activities as early in your day as you possibly can. Because from a time management standpoint, maybe if you just take the first 10 or 15 minutes, you can knock off 2 or 3 of those. If you have more time blocks here or there, maybe you have a 5 or 10-minute time block in between appointments, and you can knock out 1 or 2 of them there. So that's how we can more effectively utilize our time. The second concept that applies to this is, let's say you've identified 3 A activities today. Well, what you do then is you estimate the time you need to complete each of those 3 A activities, and you go in this order. Number 1 A priority is the activity which takes the least amount of time of the 3. The second A priority is the activity which takes the second least amount of time. And then the third A activity is the A activity that takes the most amount of time, or if you want, the third least amount of time overall. And the reason for that is when you go least amount of time followed by second least amount of time, you will, in the shortest amount of time, knock off 2 of your 3 A priorities. And I have an example of that for you in just a moment. So when we handle tasks, here's a flow chart to consider using. So let's just go through 3 quick tasks. We accept a task and we ask, is it important? To the left, no, it's not important. So we already know it's not important. It's either a quadrant 3 or quadrant 4 activity, and we want to ignore it or downgrade it in priority. Once we've done that, we ask, can I prevent the recurrence or repeating of this unimportant activity? And if the answer is no, then stop. If the answer is yes, though, follow the line down and then into the green box. Because whenever you can prevent the recurrence or repeating of an unimportant activity, you want to make it a priority. You now have a new quadrant 2 task, which is very important. It's not urgent, because you want to arrange the prevention of any and all non-important activities. All right, let's accept the second task. Is it important? Yes. Is it urgent? Yes. Now we're in the yellow box, which is quadrant 1. It's important and urgent. Must it be done now? No. Must it be done today? No. Then time charge it as an A for a specific day. Must it be done today? Yes. Then time charge it as an A for today. Then back up to must it be done now? Yes. Then we do it. The point is, every time you complete an activity that has made it into quadrant 1, you follow this line down, and you see the diamond with the question, could the urgency of this quadrant 1 activity be prevented in the future? In other words, Could I get to it the next time it happens while it is in quadrant 2? If the answer is yes, you see you now have a new quadrant 2 task, which is to arrange the prevention of urgency. In other words, the next time this task comes up that was just in quadrant 1 that you just completed, get to it while it is still in quadrant 2, because I promise you, you will finish it faster and better than you just did when it was in quadrant 1. Let's accept one more task. Is it important? Yes. Is it urgent? No. Aha, we're in quadrant 2. Does it have a date or deadline? No. Give it a date or deadline. And now that it does, ask, is it a be there? Is it an activity that I must complete on a specific day at a specific time and in a specific place? Maybe the office. Okay? Is it an appointment? If the answer is yes, then time charge it in the calendar. It goes specifically on a specific date, specific time, and that activity, whatever it is, will occur in a specific place as well. If it is not a be there, then time charge it on your task list. The bottom line is, though, you want to encourage and reward all quadrant 2 activities for today and going forward in the future. All right. Now, let's go through a quick exercise where we can prioritize our to-do list. I have now 6 activities. I'm going to add a couple more. So we have a total of 8 activities. And I'm going to label the quadrants. On this particular day, this is a day that happened previously. It was a very good day because 7 of my 8 activities were quadrant 2 activities, important but not urgent. Then mark the A. I have 3 A activities, and estimate the time I'm going to need for those A activities. 10 minutes, 20 minutes, hour, 30 minutes. And add up the A's, including a buffer. So again, that was 2 hours for those 3 A activities. 2 10-minute buffers gives me 2 hours and 20 minutes that I had to budget that day into my calendar. And now let's number the A's. So remember, look in the right column, set up interview with Sarah, least amount of time, that's my A1 activity. Call John Franklin regarding job fair, second least amount of time, 20 minutes, A2 activity. Complete a report, 90 minutes. Third least amount of time. Also, though, the most amount of time of my 3 A activities. So the order in which I'm going to complete these is set up interview with Sarah, least amount of time, followed by call John Franklin regarding job fair, 20 minutes, and then complete XYZ report, 90 minutes. A1, 2, and 3. And then when you can number the B activities, and that's a separate exercise that we're not going to dive into right now. Okay. And then, of course, cross them off when you get them done. Now, for planning your day, I can't begin to recommend this strongly enough. And I understand that many times you are scheduling appointments, sometimes very late in the day, for the very next day. So I recommend, as and when you're doing that, to plan your tomorrow starting today. Before you leave work today, start at least to plan your Friday. And I know I'm going to get some pushback on the second one, and so if you don't want to do this, I understand. What I suggest, though, for those who are open to it, is if you wish, if you are more of a night person, you get things done really well at night, maybe just take a minute or two tonight and take a second look at your calendar or schedule for tomorrow. I happen to be a morning person, so what I will do is tomorrow morning, and this is before I'm sitting down to get work done. Sometimes I work out of a home office, sometimes I'm at a client site, but either way is I recommend taking a quick second look at your schedule for Friday, maybe for a minute or two. I'll do it probably while I'm taking care of our dog and watching the news or whatever. And then just take 2 minutes, right before you start working, take that third last look at your calendar and schedule for Friday, and then just start doing this. If you're not already, just start doing this every day. So, what steps will I take to effectively prioritize? Again, when I've conducted this as a seminar, this is what people have said. I'm going to focus on my top three. I'm going to focus first on things that are important, then urgent. In other words, quadrant two. A number of others have said, I'm going to get my quadrant one stuff done ASAP so I can get it out of the way. Many have said, I'm going to focus on quadrant two activities. Spend as much of my time every day there as I can. High importance, lower urgency. And many others have said, you know what? Get the other stuff, quadrant three and four, unimportant stuff done when you're able. Guess what? A lot of that just sort of slides away. Begin before you leave home. Many like that idea. Do a recap at the end of the day to see what you actually achieved. Acknowledge your goals. And one of my favorite suggestions that people offer from time to time, and I've done this a number of days, maybe you have too, do the most unpleasant thing first, then you're not dreading it all day long. I think that is an awesome, awesome suggestion. All right, so for planning your day, here are the steps. First, acknowledge your achievements from the previous day. 2, update your task list. 3, transfer the be theres, and this is already done electronically. Block out routine activities. Okay, this is what I mean with that phrase. Let me use email as an example, okay? And I understand, believe me, I work with physicians, surgeons all the time, and I understand that occasionally an email, if it's coming from another physician, if it's coming from someone who works for another physician, there might be x-rays, ultrasounds, PDFs, and or other patient information that needs to be either looked at and or incorporated into scheduling maybe a call with that other physician. I understand all those examples. What I'm suggesting here, though, is this, because one of the surgeons I coach regularly actually came up with this. Here's what he came up with. He started thinking through all the priorities that he has. The first, of course, is to perform surgery, because sometimes he's saving someone's life. The second is to conduct appointments, patient appointments. The third is often consults, either with patients and their families and or with another physician, and so on and so forth. And finally, when we got to email, he said, email is probably my 6th or 7th highest priority. And so I said, so what do you want to do about that? And he said, now he does have an assistant who works for him. Maybe, you are assisting one or multiple physicians. And so here's what he said about email. He said, first of all, I have someone who handles that, who manages that for me. You may be that person, okay. And or this is what he said, though, about email. He said, the only reviews I, as a physician, need to do of email is 3 times a day. And so what he decided and what he does, and this is a surgeon who has patients come to him from all over the world, is 3 15-minute time blocks. 15 minutes at the beginning of the day, 15 minutes in the middle of the day when, he can squeeze it in either between surgeries or in between appointments, and then 15 minutes very close to the end of the day. Maximum the surgeon spends on emails is 45 minutes. And so all I'm suggesting is conceptually, you may be able to do the same. You may be able to isolate 3 15-minute time blocks for your email. 3 15-minute time blocks, beginning of day, middle of day, and end of day for your email. And I suggest this primarily because Usually most of our highest priority, high urgency and also highly important activities are going to involve a phone call, often in place of an email. Now, if your office accepts patient appointments online, if people can schedule appointments online, okay, that has to be taken into consideration. But ultimately, email in almost every case can be isolated into a specific time block so you don't have to continually be checking email all day. Now, if someone who you work for or work with has a different expectation around that, that might prompt an opportunity for you to have a conversation with that physician, with that office manager, whoever it might be, to suggest that email could be isolated into smaller and fewer time blocks so you can focus more of your time on what is truly, truly important, but not yet urgent. Okay, so of course we mark our A time, and now I'm going to offer just one more new suggestion. We've been talking so far about all the things we are required to do, all the things we have to do, we need to do, we are told to do, and those are all important. Some of them are important and urgent. However, how about selecting one activity each day, which is something that you want to do for yourself, that you're looking forward to do, whether it's having dinner with someone special with your family, whether it's going to exercise, whether it's even just going for a walk, okay? Whatever it might be, I suggest, just as you have to schedule all these appointments, all these other activities, you're required to do so for work, schedule one thing for yourself. And if you need to do that on a separate Outlook or calendar or whatever, fine. But do that for yourself, because when you have at least one activity that you want to do, that you're looking forward to do, maybe it's well into the afternoon or evening, it often will make your day go by a lot better and a lot faster. All right. So here's an example, and this is from a day I had. It was a Thursday in August. And so yeah. So I want to show you how it started. I had a number of things that were already planned, already scheduled. And then let's see if it does this automatically. Yeah, okay. There we go. Okay, so here is how that day played out. And I share this with you just as an example. On that particular day, I had 3 A activities. And I managed to get all my A activities done by 11:30. I did have to speak with Sam regarding the team course at that time because Sam was about to board a flight and he was teaching that team course the next day. I met my colleague Sarah at Harpo's, a local restaurant. We had a pre-scheduled staff meeting. You may have some of those. I had another hour for some B activities, although I can tell you that most of that particular day, it was a very good day, was spent focusing on quadrant 2 activities, important but not urgent. On that particular day, I did my planning for the next day at 4:30. And I should tell you that I often will start planning next week on Thursday afternoon. We'll talk about that in a minute. And I had 2 choice activities that day. I worked out at Timeout, our local health club, from 5:30 to 6:30, and then I read to my kids that night from 8 to 8:30. It was a really good day. Okay, so our goals, of course, we need our goals to be SMART. Our goals need to be specific, measurable, achievable, relevant, and time charged. So now let's start to think about how we can move towards true effectiveness. And the guiding principle here is that doing things faster is no substitute for doing the right things. So remember that time management skills hierarchy. We started when we were kids. I'll remember, hey, Billy, hey, you know what? I'll meet you at the playground. Let me just get this little Outlook reminder off my screen here. There we go. Okay, and now let's go back here to our presentation. There we go. Okay, so I'll remember, hey, Billy, I'll meet you at the playground, maybe after breakfast, whatever. Okay, we didn't have a system. Then at some point, maybe we were in high school, maybe college, who knows, we started using maybe Post-it notes, string on the finger, notes on the napkin. We write something down, a little ad hoc system. Then at some point, most of us, maybe we started using like a little black book. And, I know a number of kids who would use one in high school, desktop calendar, whatever. And then at some point, we started to graduate a little bit. Organizers, smartphones, Outlook, that was our efficiency-driven system. So again, we're trying to help you today take all the tools you're already using to manage your time and give them more of a mission focus, more goal-oriented, more purposeful, better prioritized. That's going to make you more and more effective with how you manage your time. All right. And there we go. Okay. So it's efficient to do things right. It's effective to do the right things right. So we want to prioritize our activities every day on what are the most important activities. Those are the right things to be doing, and we want to do the right things right. It's efficient to be practice focused. Isn't it interesting that we use that term? Because you may work in a medical office or so-called medical practice. So that efficiency has a lot to do with that. And we respect that. That being said, though, it's effective to be principle focused. What are the highest priorities here? It's efficient to be focused on the schedule. It's effective to be focused more on our relationships. The relationships maybe we have with our patients, with our clients, with family members. It's important to focus on relationships that we have with our coworkers, maybe with our boss, our manager, our supervisor. And frankly, sometimes we run into a conflict with either a coworker or maybe with someone who we report to. And when I've had those issues, I try, first of all, it's important, of course, whenever we have a conflict, to sit down with someone privately and talk it through. And I always start those conversations with, I was thinking about this, this conflict we're having, and I keep thinking how important it is that we have a really good working relationship. That's important to you, isn't it? That's how I suggest, and I'll do this every day, many, many times. I will suggest to someone who's having a conflict to start the conversation, the private conversation with that person in that way. You want to be sure that they are as interested as you are in having a good, productive, working relationship. Okay. And now it's efficient to focus on urgent tasks, and let's be real, sometimes that's what we have to do. That being said, and I do say this with great respect for the work that you do and the work that people you work with do, is what's really important? What's really urgent and important? Well, saving someone's life is important, and medical professionals do that every single day, hundreds of thousands, if not millions of times all over the world. Okay. It's effective, though, to focus on tasks that are important. So we respect the great work that medical professionals do every single day. Obviously, saving someone's life is both important and urgent. That's a quadrant one activity if there ever was one. That being said, though, as long as we're not, part of a surgical team trying to save someone's life, it's more important to focus on everything that is highly important. Will some of these highly important activities also be important and urgent? Absolutely. And we know how to deal with those. It's just that when we can spend as much of our time every single day every single hour, every single minute, focusing on tasks that are important, but that have not yet risen to a level of high urgency, that is when we are in the best time. And let me give you one more example. My father, God bless him, just turned 84. Um, However, he has not been the most mobile person. He has been sedentary by choice. And okay, it's part of who he is. He gets a lot of work done. For many years in his life, he was an executive recruiter. He'd have to spend time on the phone, sitting at his desk, also on the phone. Okay, I get all that. That being said, though, at age 60, my father had a very, very serious heart attack. And the problem was, um, um, let's just say it was sufficient to cause him to require quadruple bypass surgery. So maybe not the best diet. He did make some changes. However, and I say this with great respect and love for my dad, he is still one of the most sedentary people I know. Now, he has eaten much better. His diet has significantly improved. He's kept his weight down. However, he's at a point now where he's 84, where he's not the most ambulatory of people. He's of slender build, so that's good. He's not overweight. However, his mobility is terrible. And if he had done a better job when he was younger of, both his diet, but frankly, much more importantly, exercising every day, like my mom, who is 85 and who, God willing, barring something unforeseen or whatever, I think maybe make it to 100. In large part because, in addition to raising her 7 children, my mom has always been an outdoors person. She's always been gardening, going for a walk, exercising. And she still does to this day. Has she occasionally had an issue with a hip or a knee? Yes. However, her overall health is extraordinarily much better than my dad's. And so all I'm saying is I have learned from watching them as a reminder of how important it is to focus on what is truly important. What do we all know is truly important? The best diet and the best exercise we can do. And I learned something else from, I'm forgetting his last name, but Mr. Petrosian, who was one of my clients when I was selling life insurance for Prudential. At the time, I was in my 30s and Mr. Petrosian was in his mid 70s. And he was purchasing a very expensive life insurance policy because he wanted his assets to go to his wife, obviously, if he died first. But once the two of them died, he wanted to be sure that their assets were placed in a trust. So he had to undergo, I think he was 72 at the time, and he had to undergo extensive, examinations. The insurance company he was getting millions of dollars of insurance for a lot less than that. And I remember having a conversation with him one day. I said, you appear to be in great shape, and your cardiologist has said you're in phenomenal shape for someone who's 72. Could you tell me what your secret is? He says, well, I try to eat only when I'm hungry, drink only when I'm thirsty, and I try to eat and drink well, smartly. He says, I enjoy a good drink. Didn't smoke. I enjoy a good drink now and then. And, I like to enjoy, like a really good thick steak once in a while. But he said, otherwise, what I do is I go for a 1-mile walk every single day. He said, I've been retired for a few years now, and yet still I go for a 1-mile walk every single day. It's by focusing on what is truly important and not urgent that will in most cases, allow us to live a long life, but also to improve our productivity and ultimately our effectiveness with our work, with how we manage our time, and frankly, with our life. Okay, so let's think for a minute about what's truly important. All the roles that we have in our work and in our life. And I want to encourage you, maybe they're on these lists you're seeing cascade on your screen, and maybe they're not. I'd like you to write down 2 roles that you have professionally and 1 role that you have personally that are truly important and meaningful to you. And if you will indulge me, while you're writing those down, let me use myself as an example here. So 1 professional role, it's in the first column, that's very important and meaningful to me is that of coach. I coach a lot of people, mostly executives and senior managers, and I coach them one-on-one. And that role is very important and meaningful to me because I truly help people to improve their performance, to talk through issues they're having. They confide in me extensively because they know they can trust me to keep confidences. And I don't mind telling you, and use this if it works for you, that the one primary rule I use, and this is not just as a coach, but this is as a manager and this is as a person, is when we sit down, whoever we are, 2 of us one-on-one, and we talk about something, whether it's at work or something else, as long as neither of us are discussing anyone doing anything illegal, everything we discuss stays in this room, or if it's a Zoom call, everything stays on this call. It doesn't go anywhere. So coach, for me, is a very important and meaningful professional role. I get to help people sometimes, and I'm not a PhD psychiatrist or psychologist, so I'm sure I'm very certain to explain that to people and say I cannot and should not venture into certain realms. I mean, sometimes people can have a personal problem and they want to talk about it, and I'm there to listen. I'm not necessarily there to offer advice if I think it's outside of my realm of capabilities. But I have helped people who I coach, sometimes with a personal issue, most of the time with a professional issue. And it's almost always a relationship issue, a working relationship issue. It's either a direct report, or sometimes it's a colleague, or sometimes it's a superior. And so I often remember this as well. And I share this with you for any of you who are also in a managerial role. Our number 1 job as managers is to provide that person who reports to us with as much support as we possibly can to enable them to perform at the highest level possible. My favorite example of this is how I learned it. And it came from my manager, Brian Bogosian. Brian hired me to manage a call center. And he said, the day I started, he said, everyone here is on a 90-day probationary period. I said, okay, I got 90 days to prove myself. Here we go. And for better or for worse, 90 days went by, and Brian didn't say word one to me. He didn't call me. He didn't stop by my office to see how things were going, even though we worked on the same floor in the same company. And one day he leaves a voicemail message for me. He's like, Chris, hey, it's like, we have this big problem. I've got to head out to a meeting right now, but when you come in tomorrow, first thing, I need you to come right to my office, okay? And I was like, oh my God, I didn't sleep very well that night because he said we had a big problem. And then it got worse for me for a moment because when I arrived at his office door the next morning, he gives me a very stern look. He says, close the door and have a seat. And all I can think is, oh my God, it's 90 days. I have no idea what I've done. I have this terrible feeling, though, that I've done something wrong and I'm about to be let go. Well, that wasn't the case. As he told me later, I had turned red-faced and I'm sweating. And he said, I'm so sorry. He says, I didn't call you in here to chew you out. I called you in here to apologize. And I'm blown away. And I'll clean this up just a little bit. He said, I haven't done, I haven't done squat to help you. And he said, that is my bad. That is my mistake. He said, I should have been checking in with you to see how things are going. I should have been following up with you, and I didn't do that. He said, I failed you as a manager because my number one job as your manager is to provide you with as much support as I possibly can to enable you to perform at the highest level possible. He says, that's going to stop going forward. He said, from now on, at least once a week, I'm either going to stop by your office or I'm going to call you. In the meantime, anytime you have a problem, question, whatever, call me or stop by my office because I'm here to help you. So I suggest we as managers, those of us who are managers, hold ourselves to that standard. And for those of us who are not managers, that we hold our manager to that standard. That is their number one job. If we are a manager, that is our number one job. Okay. The second professional role I'd like to choose for myself is in the middle row. It's that of facilitator. And that's important and meaningful to me because I facilitate strategic planning, team building. I help groups of people who work together improve performance. That's why that role is important to me. And then the third role I'm going to choose is actually in the third column, and it's a personal role, and it's that of parent, because I choose to believe that parent is actually probably the most important role I have and will ever have going forward. When I can influence and try to mold and shape a young person, help them grow into a fully functioning, mature adult, I think that's a pretty important role to have in life. So again, I want to encourage you, identify 2 professional roles and 1 personal role that are important to you, because rest assured, we're going to get to those in just a moment. Okay, 2 professional, 1 personal role. Now let's move on. So let's name this picture. We have inputs, and we put those inputs through a process, and we hopefully arrive at a desired output. Well, along the way, while we're taking those inputs and putting them through a process, we often will receive some feedback, and we're often told, or we understand already, that there are certain standards that we have to observe as we're putting those inputs through a process. And we also always have to work in our environment under certain conditions. Well, we call this process OPICS because the outputs are what we produce. The process is the method or strategy that we follow. The inputs are who else, what people, what information, what material resources do we need. The conditions are our absolute requirements, our values, deadlines, budget constraints. Anytime we worked on a project, what are the 2 highest priorities? A project should be completed on time, deadlines, and on budget constraints. And then finally, our standards are our metrics and targets. And physicians use these standards all the time. You know, when they're treating a patient, sometimes that patient's not going to be cured or healed in one appointment, in one meeting. Sometimes that patient's going to be healed, cured, or improved over a period of time. So how do you measure progress along the way? And our goals, of course, have to be SMART, specific, measurable, achievable, relevant, and yes, time charged. So we're talking about taking a goal, whatever that is, and making it a reality. We have tasks to complete. We have objectives to meet. We have product specifications. Sometimes there will be a physical deliverable involved. It might be improvement of an organ. The program is, what's the list of steps we have to follow to accomplish our task? Do certain patients need to be seen over time, as they hopefully improve their condition? And the schedule, of course, is when each of these steps occur. Well, just as we were planning our day, I suggest 3 different times. Again, for planning a day, this afternoon, I'll take my first look at Friday. I'll take my second look at Friday, a couple minutes tomorrow, as and when I'm waking up. And then third look at Friday calendar and schedule will be right before I start working tomorrow. Well, let's get to your roles. Here's a great way to plan your week. Start with your roles. What is the most important thing I could do in my 2 professional roles that are especially meaningful and important to me? And what's the most important thing I could do in my personal role that is meaningful and important to me this week? You could identify over the course of the following week what's the most important thing you could do in each of those 3 roles. And I think that's an excellent start. Also, evaluate the previous week. So maybe do this tomorrow. Take a quick look at some point tomorrow and say, okay, over this past week, what went well, and what, if anything, would I change? And allow that learning, those experiences, help you as you're planning next week. And of course, document your accomplishments. And finally, organize your upcoming week. Plan time to plan. So this is what I use. Use it if it works for you. I plan each week just like I plan each day 3 times. I tell you this. Today is Thursday, April 28th, and this afternoon, I will start planning. I will start planning tomorrow, but I will also start planning next week. So this is what I do. Do this if this works for you. When I take a look at the next 5 days of next week, Monday, Tuesday, Wednesday, Thursday, Friday, I start by saying, okay, for whatever I already have planned and scheduled for next week, what are my A activities? And make sure those are highly prioritized and scheduled as early in the day as possible. And also, if there are any other activities for next week that are not A activities, when and where are those scheduled? Where are the priorities involved here? How well prioritized is my calendar, my schedule for next week? So that starts this afternoon. The second time I plan my next week is going to be sometime tomorrow. Now, for me, I'm very much a morning person, so chances are I will take my second look at next week's schedule tomorrow morning. If you're more of a, not such a morning person, maybe you do it tomorrow afternoon. But when you take 2 looks at your schedule, your calendar for next week, this week, that gets you 2/3 of the way towards having a very well planned and prioritized week. And then the third time I'm going to look at my calendar, my schedule for next week is going to be Monday morning. Because when I sit down Monday morning, I'm doing my final look at my schedule for Monday, but I'm also doing my priorities. How well prioritized and planned is my calendar, my schedule for next week? All right. So where are we now? Sorry, there we go. So now for planning and prioritizing to make smart decisions under pressure, how will you respond to these key pressures? Well, when customers or patients are demanding, how may I help you? You know what? Here's a concept that I was taught. This is ours to understand and solve together. In other words, when someone presents a problem that they have to you, whatever it is, make their problem your problem as well. So you share in ownership of the problem, and then you share in ownership of the solution. Because when you ask someone else to help you understand and analyze what the problem is, they are far more likely to remain with you to participate in the solution. That's why we want to do the best we can to understand, hey, that's not their problem, that's now our problem. However, we are going to work together toward a solution that will also be ours. It's a great concept, and I apologize for forgetting who taught that to me first. I have found that extraordinarily, extraordinarily helpful, especially when I'm dealing with someone who's being really difficult to me. You are my highest priority. When a prospective customer has high expectations, the same thinking. How may I help you? This is ours to understand and solve together. You are my highest priority. Focus on them. All right, for our coworkers' needs, understand each other's priorities. You know, Stephen Covey, in his outstanding book, The 7 Habits of Highly Effective People, shared this insight. He said, seek first to understand, then to be understood. When we ask someone else questions so we can better understand where they're coming from, most of the time they will be in a better frame of mind to hear us, to understand what we have to say. Also, great advice from one of my managers at Prudential one day, John Breedlove. He looked at me. I was kind of like a young hotshot, somewhere in my 20s. He looked at me, he says, Chris, you know something? You have 2 ears and 1 mouth. Try to listen twice as much as you speak. Thank you, John Breedlove. Great advice. So understand each other's priorities. Maybe you try to help them with their highest priority, and they can help you with your highest priority. So maybe the two of you can work together towards solving a problem, and this way you wind up solving 2 problems, your problem and their problem. If the managerial environment is challenging to you, go and meet with your manager and maybe consider, you know, whoever you are, whether you're a physician or somebody else, you know, I want us to have the best of working relationships. So could I just review my schedule with you, all my activities, and maybe get your input on, of all these activities here, what do you want me to focus on first? What are the first 1, 2, or 3 things you really want me to put a high priority on? Because when you get their input to confirm it, again, when you ask someone else, in this case, it's your manager, to help you understand and analyze a problem, in other words, review your schedule because you're trying to figure out, okay, what are the highest priorities here? They are highly likely now to remain with you to participate in the solution. You're asking them for their input. If time deadlines are a big challenge to you, plan and prioritize each day and each week. And if the pace of organizational change is driving you crazy, hey, what are our beliefs? What are our values? What's really important to us here? What is our goal here? What is our goal? What are we trying to accomplish? So here are 25 pressure relieving suggestions. These are some time, energy, and frustration savers. Set time limits on all appointments and phone calls. Always confirm appointments and flight times before leaving the office or home. Keep a folder for reading items and use waiting time before meetings or appointments as opportunities to read those items. Maybe enroll in a speed reading course to reduce your reading time and increase your comprehension and other reading skills. Number 5, order books on tape or CD for review while driving. Order these online, Kindle for review on your time. Maybe Netflix, or I have to tell you, I love this thing. It's called Masterclass. It's an awesome program. I think it costs like $185, and I know not everyone has that, but I learned so much from people who teach those classes. And they're almost always 60 to 90 minutes. They go by like that. Before writing an email, decide if a brief telephone call will produce the same result, okay? 7, develop specific written procedures for repetitive tasks for ease in training others. Number 8, file things daily to avoid paperwork from piling up. 9, note a throwaway date on all files. Yeah. 10, if you read junk mail, do it during lengthy but necessary phone calls. 11, schedule time each day to review your mail and email. For each piece of mail, decide whether to deal with it now, delegate it, dispose of it, or decide when to do it and schedule it. 12, if you use photocopy machines, use pre-punched paper. That eliminates 3-hole punching. Maybe you have information that needs to be kept in 3-hole binders. I know a number of people in offices who do. And there you go. And oh, by the way, for all of these, use them if they work for you. Don't use them if they don't work for you. There are 25 of them here. Maybe pick out 2 or 3. 13, schedule buffer time for completing activities to avoid working under pressure. This is, and again, I apologize for forgetting who taught me this. I am telling you, this concept of even 5 to 10 minutes buffer time for activities has reduced my stress significantly. Okay, 14, write a list on paper, the key talking points you'd like to cover before you make a phone call. This way you're ready. Bing, bing, bing. 15, save contact information on your smartphone, especially the people you interact with the most, your key customers and coworkers. And I don't have this in here, but if you haven't already, sync up your smartphone with your laptop or computer if you are able to. I am able to, and it saved me extraordinary time. 16, be prepared before you attend a meeting. Use a blank piece of paper to list items. Just write them down, items that you'd like to discuss, and that can include a meeting with your manager. If you're holding a meeting, inform others what you expect them to contribute and only invite necessary people. 17, inform all meeting attendees of the objective of the meeting. 18, start meetings on time and schedule interesting items first to decrease the number of latecomers. Also, FYI, finish meetings on time. Only go over if people agree. Respect others' time and they will respect yours. 19, shop online as much as you can, though avoid doing so when you are working. 20, be a contrarian. When you have to shop in person, do so during off hours. 24-hour stores, early or late, never on Friday. Visit busy places when the crowds aren't there. Buy gifts at times other than the holiday season. Avoid peak times. For example, I'm the oldest of 7. I have 6 siblings. I have 6 brothers and sisters-in-law. I have a spouse. I have 2 children. I have 11 nieces and nephews. I have 2 parents. Small family. One year, a long time ago, I found myself in a mall. I grew up in northern New Jersey. I found myself in the Willowbrook Mall on Christmas Eve at 3 p.m. And I said, never again. Sure enough, ever since, I've been a year-round Christmas shopper. I'm also a year-round birthday shopper. All I mean is this: when I see something that makes me think of someone, I buy it. Because I know whether it's a birthday or Christmas or some other holiday, I can give it to them. And it saves me a lot of time. There you go. 21, keep cards for all occasions on hand to avoid trips to the stationery store. So keep a bunch of thank you cards and keep a bunch of blank cards that you can write in. When delegating, clearly define expectations and due dates. 23, when delegated to, clarify expectations with the person delegating and any other unclear items. Very important and often forgotten about or ignored. 24, each and every day, make sure you block out time, which is important to you personally. Exactly. 25, and again, I apologize for forgetting who taught me this, but I love this. Whenever you are stressed out, when you can, physically remove yourself from that environment which is causing you stress. Sometimes we're sitting at our computers or laptops and we're getting all stressed out. Walk away. Now, if you're meeting with someone, interacting with someone, you're not going to walk away from them. However, see if you can take a break or see if you can somehow move off that topic temporarily and agree to revisit it. Maybe it goes into a parking lot, whatever it is. When you can, whenever you can, physically remove yourself from an environment which is causing you stress, step outside, get some fresh air, walk around the block if you can. All right, so we've covered 4 objectives today. We've described the benefits of developing time management skills, differentiated between different types of tasks. We've analyzed and used some tools for organizing tasks. We've practiced some proven rules and techniques for managing time effectively. Just before we turn things back over to Jackie, let me say this. I am here with you today as long as you want, as long as you need. Yes, we have a time finish in approximately 9 minutes that's scheduled. However, I have told Jackie this before we come together. I will stay with you as long as it takes to answer whatever questions you have, okay? Now let's turn things back to Jackie. Go for it.
Great, thank you so much. To join the Q&A session, you may type your questions in the chat box within the webinar control panel. I will ask the questions on your behalf. Questions will be taken as time permits. Okay, our first question today. Is there a difference between being efficient and productive?
That's a great question. So, is there a difference? Well, efficiency is very closely tied to productive, and efficiency and productivity are both aligned around getting what you need to get done, in as short an amount of time as possible. That being said, though, there are tasks that are important but not urgent, that often will require a little more time, a little more thought than it might if we are under a time crunch. So, to your question, there's great value in efficiency. Let me be clear about that. There's more meaning, though, and this actually ties into productivity around being effective. For example, you might have a certain series of tasks that you have to complete each and every day. Okay, the more you practice those tasks, whatever they are, the more efficient you become because you get better and better and better at doing it. So that's great because you're working hard and you're working smart. That being said, though, there are often some tasks that involve a little more thought, reflection, that might be accomplished more effectively if you dedicate 2 or 3 different time blocks to getting them done. So that's not necessarily the most efficient way of doing things. However, it is definitely the most productive way of getting them done. So productivity can include both efficiency and effectiveness. I hope that answers your question. That's a great question. Thank you.
Great, thank you. Our office is short-staffed, yet still experiencing high patient volume. I am filling the
Mm-hmm.
gaps in our call center and front desk as needed. How can I get my manager to understand that my managerial tasks are being neglected because of the gaps I'm filling? I'm very frustrated and often feel defeated.
Mm. Wow. First of all, I seriously, seriously feel for you. And I'm not just saying that. I work with people every day in offices who are in similar situations. And again, to your point, that includes a lot of managers I work with who are under tremendous stress and pressure, in large part because they're short-staffed like you. So um, here are a couple of suggestions. First of all, when you can, and maybe, and forgive me, maybe you have to do this at home when you're just away from all those pressures. but give yourself the time and the space that you need, first of all, to write down every single task that you need to do. And I know that's going to be a little bit painful for you. However, include in that list, maybe you have two separate lists, and this is up to you. What are all the um, um, tasks that you have to complete? And maybe those are all, like, for lack of a better term, customer and customer service and patient service related. That's fine. And maybe the second list is all the managerial tasks that you are not getting to. And this is frustrating you, and I get that. And so then I definitely suggest you need to, arrange with your manager to have a sit down, or if you don't work in the same office, maybe it's a Zoom call, whatever. But you need to have a private meeting with your manager where you can review those two lists. And I advise that you first of all, you say, I need to review a couple of lists with you, because the goal here is to make sure that I'm doing my job as best as I possibly can. And manager, I know that's important to you too. And so now you present the one or two lists, maybe it's the two lists, so your manager can understand these are all the things that I get to. So this is how I am spending my time. However, these are all the tasks, and these are managerial tasks that I'm not getting to. And so here are the two lists. What do you advise? What is truly important to you as my manager for me getting these done? And my hope is that by showing your manager these two lists, what you're getting done and all the things you're not getting done, that your manager hopefully will be sufficiently open-minded to say, okay, let's figure this out together, how we can make better use of your time so you are able to get at least some, if not most or all, of these managerial tasks completed as well. I hope that helps you. I have learned from experience that first I write it down, and then I say, okay, we need to sit down together and look at these together. So we're looking at facts, we're looking at information together, so we together can make an informed decision. I really hope that helps you. Thank you.
Great, thank you. Can planning all of my time become stifling?
um, well, it could, if you allow it to, and I say that with respect. I don't want you to become or feel stifled. I'm just saying that when you dedicate very small amounts of time, that's why I'm saying, like, for planning each day, it's really a total of 6 minutes. 2 minutes today for tomorrow, 2 minutes at home, and then 2 minutes just before you start your day. So it's a total of 6 minutes to plan, I don't know, 6, 7, 8, 9, 10 hours, however long your day is. And so my hope is that by breaking it down into these little, bite-sized gulps, that they won't become stifling. And also for planning your week, I have found that I am able to, I think it's a total of only about 15 minutes. So it's 3 5-minute time blocks. I should have mentioned that before. I apologize. So it'll be 5 minutes this afternoon. It'll be my first look at next week. 5 minutes tomorrow morning for me. Second look at next week, and then 5 minutes before I start my week on Monday. So for me, it's a total of 6 minutes to plan each day and 15 minutes to plan each week. And so for me, that's not stifling. For me, I have found that it saves me a lot of time. It frankly saves me a tremendous amount of stress, because I will say this too, and I haven't mentioned this so far. Like all of us, there are times when I have trouble sleeping. I'm thinking about something, it's bugging me. And so what I do is I have this little notepad, and I write it down. And so I know that when I've written it down on my little notepad there on my nightstand, that now hopefully I can get back to sleep, because I know that once I wake up, after hopefully the rest of a good night's sleep, I can wake up better. I hope that helps you. It's a total of 6 minutes to plan a day and 15 minutes to plan a week. And I hope that that might not be stifling for you. Thank you. Great question. Thank you.
Great, thank you. How do you recommend we encourage time management amongst our staff members and/or in an office setting?
Aha. Well, and I promise you, I'm not saying this to be self-serving, because there are many, many outstanding providers out there. I do recommend that it should be a shared experience, that you bring this concern that you have to your manager, and say, I think it would be great if all of us could, take it. It's only a 90-minute class, but if we all could take it together. And again, there are hundreds, if not thousands, of outstanding providers of that. Where I'm going, though, is this. Conceptually, when all of you together can go through the same learning experience together, it goes a long, long way towards helping all of you. And in case you get some pushback about where on earth are we going to find 90 minutes that we all can do this, I will just share with you this. I am actually facilitating a retreat a week from Friday for a veterinary practice, and I have facilitated this kind of like a 90-minute webinar like the one we're on today for a lot of medical offices. And I said, there are hundreds, if not thousands, of outstanding providers out there. That's what I'd actually recommend. That's what I'd recommend. Thank you.
Great, thank you. Do you have a standard tool that you use that can help? Maybe a calendar or ready-made spreadsheet?
Yeah, for me, it's Outlook. Um, it's Outlook, and I do know some people, especially in finance, who use Microsoft Excel. That doesn't work as well for me, but I find Outlook is great. I know a number of people who use Google Calendar, and that's available online. It can be shared. Um, Microsoft Outlook, of course, is online and can be shared. And there may be other tools out there with which I'm not familiar. So seriously, if anyone on this webinar knows of any other tools that they use or can use, that I haven't already mentioned, please feel free to suggest those in the chat area, and Jackie will work with me to get those broadcast. Excellent. Great question. Thank you.
Great, thank you. And this will be our last question for today. How can an office manager help an associate in the office who struggles with productivity?
Ah, okay. So, great question. And so, first of all, obviously, the two of you need to sit down together. But before you sit down together, um, I want to encourage you to consider this approach. So this person is struggling with their productivity, and you may or may not know what, if any, issue or issues this person may be having. And I'm not saying they are, but sometimes it can be a personal struggle. There could be a personal issue involved. Sometimes it's a mental issue, whatever. I want to encourage you to do this. First of all, you do this and have them do this. Before you meet, ask them for themselves to write down all the things that they believe they do well. And then after that, have them write down anything they think they could be doing better. Okay? And you do the same. You write down first all the things this person does well. Hopefully there's more than a few. And then write down everything that, in your view, they could be doing better. And it sounds like focusing around productivity. Then I'd like to suggest the two of you meet, and first and foremost, because sometimes it can be a self-esteem issue for that person. Um, and so I suggest you start off this one-on-one meeting where you, if you can, sit next to each other. If not, sit across from each other and um, exchange lists, because it's important for you both to see what each other's perspective is, first on all the things this person does well, and then it'll be great for you to see anything that they believe they could improve. And what's really important about that process is that it will help you understand better where they think they need to improve, and to see, hopefully, that at least some of those things are the same as what you've written down. Now that you've had that kind of exchange of papers or exchange of ideas, you two can work together. You can sit down together to talk through this. Okay, hey, here are all the things you do well, that's great. Now let's focus together, either side by side or across from each other, on everything that you could be doing better. Now, maybe there's some things on my list that weren't on your list, but that's okay. Let's focus together on everything from both of our lists. Because when you go through that process with them together and privately, there's a far greater chance that they will be able to improve their productivity because you've engaged them that way. It's a very respectful way to engage them, because you're showing them that you want to work with them to help them improve their productivity. I hope that helps you.
Great, thank you. We're going to squeeze one more question in. What would
Okay.
you say is the best way to avoid distractions when working?
um, let's see. Best way to avoid distractions. Well, first and foremost, eye contact goes a long way. And so, what I mean by that is to avoid distractions when you can, focus to the best you can on, maybe it's the computer screen in front of you, or maybe it's the person you're interacting with. Um, if It would depend a little bit on how and how frequently those distractions are occurring. I will say this: um, it takes time and it takes practice to learn how to focus and not become distracted. So, if it helps you, maybe just write down what it is that's really important to you, that you want to work on, that you need to work on to get your work done. Now, if some of the distractions are your coworkers, okay, that happens too, and so that's a little bit trickier to deal with. Um, and so I'll do like a mini little role play without you being here. But let's say my coworker is Sarah, and Sarah is causing me all kinds of distractions. She's like, she's a very distracting coworker. And so, hey Sarah, how you doing? It's like, so what's up? Okay. Um, Sarah, I want to help you. I do need to really focus on what I'm doing right here, right now. Um, what is it, and is it something we can discuss, a little bit later today, or tomorrow, like what's going on? Because I really need to get this done. And so where I'm going with this is, if the distraction or distractions are coworkers, part of what we have to do is to educate that person or those people that, I have to assert myself. And this is what I need to focus on to get my work done. And I need you to respect that, just as I respect you in the same way. I hope that helps you. Thank you.
Great, thank you so much. Healthcare Training Leaders' mission is to help you be more successful by breaking down complex topics into easy to implement steps to save you time, money, and headaches. You can view all of our upcoming and recorded trainings by visiting www.hctrainingleader.com. We would like to thank Chris and our participants for joining us today and remind you that today's session was recorded and available to you at no charge. We will conclude the webinar at this time. Thank you again for attending today, and we hope you have a great day.